I was born and raised in central Massachusetts, a town called Auburn, Massachusetts, and went to college in Boston, but then went to medical school at Johns Hopkins in Baltimore. And at the time I went there, I wanted to be a general practitioner, as that was my only exposure. But during medical school, I understood and was exposed for the first time to the joys of research, how you could do research and actually help patients. And so I was stimulated by a mentor there named Richard Humphrey, who happened to work on multiple myeloma. And so I returned after Johns Hopkins internal medicine training to Dana-Farber Cancer Institute as a fellow in 1980. I knew that Dana-Farber, at that time it was called Sidney Farber, was a very famous and wonderful place for newly formed, actually, for cancer research. But my main reason for coming back to New England, honestly, was to be with my family, as I had been during medical school and training away for 8 years. And at that time, I did my clinical training, and I pursued this interest in multiple myeloma in a research way as well. And at that time, in 1980, monoclonal antibodies were new. We didn't know leukemias or lymphomas, what was their lineage or what was their cell of origin. And I was privileged to be involved in a very exciting golden age where monoclonal antibodies were made and literally transformed our understanding of blood cancers. Not only what kinds of blood cancers, leukemia, lymphoma, myeloma, but ultimately transforming the way we diagnosed and treated these diseases. And then over the years, from the 1980s moving towards the 1990s, we understood for the first time cytokines, humoral factors that help tumor cells grow, survive, and resist drugs. And then the circuits or the signaling pathways mediating these effects were defined. And then as we moved into the current millennium or current century, we are actually now able to understand genetics, epigenetics at a level heretofore never achievable. What's most exciting about my time at Dana-Farber Cancer Institute is we've been able to develop models of the bone marrow microenvironment in which myeloma lives in patients. And we've identified and validated 13 novel treatments for multiple myeloma over the past 20 years. And literally, the treatment paradigm for this disease has been transformed. When I came here in 1980, patients lived only a few months. Now, many patients have myeloma as a chronic illness and grow old and die of something else. And on average, the survival of myeloma patients is 3- to 4-fold extended compared to when we started our research efforts. So for me, it's been a labor of love at Dana-Farber, doing two things that I love. Number one, making science count for patients, and number two, treating patients as family. When I came to Dana-Farber in the summer of 1980, the Dana building was new. And the Jimmy Fund building was what preceded it. It was where, in fact, Sidney Farber had his office and did his research. So the Dana building was new, and it housed everything at Dana-Farber. That means we had our research laboratories and clinical floors and patient care, outpatient clinics, and inpatient. The 12th and 14th floors, there was no 13th floor, were derived for patient care. And then over the years, there's been an amazing evolution. The next building to come was the Mayer building, which was in fact entirely for research, and we moved to that building from the Dana building in the division called Tumor Immunology for our research. After that, there was, in fact, the Smith building, which further expanded the research capacity of our institute. And most recently, the Yawkey building, where we now have state-of-the-art clinical disease-centered centers for clinical care. And it's really been a remarkable progression and expansion in both areas. I mean by that the scientific scope and effort has markedly increased, not only in the number of individuals working here, the diversity of the individuals working here from all around the world, but the scope of research going from very basic science to clinical research and clinical trials that directly impacts patients. And I think the other thing I would say is that the joy of working at Dana-Farber has to do with the people who work here. When I came here, there were relatively few people working here. I think we haven't many thousands working here today. For me personally, I've had so many wonderful clinical colleagues over the years. I, in particular, have had research trainees come here from all over the world. I call it the United Nations Against Myeloma. And these individuals, some have stayed here. We now have a total of 7 professors in multiple myeloma at Harvard Medical School that have directly trained with us. But we also have the leaders in myeloma research and care all around the world, most of whom have come through our center. So I have professional and personal friends for life, and the advances that come from Dana-Farber are now being appreciated by patients all around the world as a result. So I think there's no more special place than Dana-Farber for doing research, something we really love, and making it count for patients, not only here, but around the world. So the culture of Dana-Farber has always been to try to make scientific discoveries, but always with an eye towards how can I help a patient by this finding. So science for science sake is of great interest. At Dana-Farber we do this, but it's always with an eye towards how can we apply it to improve the practice of medicine and the outcome of our patients. The culture, therefore, is one that attracts individuals who want to do that. I've been asked many times, why do I work all the time? Don't you have a life? And I always say to them, I'm doing what I love. I'm so lucky for all these years to be doing something that I really enjoy, which automatically helps patients. I don't have to go out of my way to help patients. I think that is the culture of Dana-Farber, and it extends to everyone who works here, from the parking garage to those in the cafeteria, to the assistants, to those researchers who come here even for a few years, or those who stay for long term. So I think in the science, the ability and the commitment is unmatched. I'm so in awe of my colleagues, especially those who come from foreign countries, often don't speak English as their native language, and work many, many hours, absolutely committed to helping patients by their science. And in a parallel way, I have a large clinical practice still, and I see patients from all around the world, and I see the commitment that all of the clinical staff have towards our patients to go out of the way and treat them truly as family. When I came to Dana-Farber in 1980, patients with myeloma could be treated, but they had survival in terms of months to perhaps 1 or 2 years at the most. And what's happened over the ensuing decades, it's now over 40 years, is a literal transformation of the treatment paradigm. When I used to see patients in the clinic, I'd see a new patient and I knew each and every patient was going to die. I did my darndest to treat with the drugs that were available, and we obviously tried to make patients and their families deal and have comfort as much as possible with their illness. But in the laboratory, with models of tumor in the microenvironment and taking advantage of the scientific advances that were occurring over the years, we've been privileged to identify many, many new targets in the tumor cell, but also in the microenvironment or the tumor neighborhood. And then we've gone on, which makes Dana-Farber very special, to be able to develop and validate new drugs, new targeted medicines against blowing the circuit in the myeloma cell or turning on the immune system in the patient against their own myeloma. So we've been part of 13 FDA-approved classes of agents. It's now 30 new FDA-approved treatments, which are comprised of those new agents. And the prognosis now for new patients that I see in the clinic is extraordinarily transformed and better. So I don't look at new patients now and think, oh, what are we going to do? I have a whole menu of strategies from which I can choose. And honestly, the paradigm has gone from high-dose therapy and autologous stem cell transplant, also derived from studies here, to immune therapies, monoclonal antibodies, immunomodulatory agents, in particular proteasome inhibitors emanated from Dana-Farber. And combinations of these agents are now used all around the world, both for initial management and when myeloma relapses. So literally, the practice of medicine in myeloma has really significantly improved internationally. And I just add that we're not done. CAR T cells, a new immune treatment, were FDA approved in myeloma yesterday. And that those modalities, among other new immune treatments, are actively being studied preclinically and in clinical trials at our center. So it's a new world, and it's so much better. Dana-Farber is leading the way and will continue to do so until we hopefully never need to have this disease active again. Since I came to Dana-Farber in 1980, there have been remarkable changes. The physical plant has markedly expanded, allowing for a much broader spectrum of research to be carried out here. And the resources, both people resources and otherwise laboratories and resources, have markedly expanded. What also has happened in the clinical side is a rapid and huge expansion in the number of programs we have, and also the simple volume of patients that come here, not only from New England and the United States, but we routinely have people coming from around the world. So I think that the extraordinary science that's done here and the capitalization of all of the scientific advances that can happen at Dana-Farber has transformed the treatment that is available at Dana-Farber and everywhere else. So it's been a bench-to-bedside transformation at Dana-Farber during my time here. Most importantly, one thing that has not changed, which is the concern for patients as people, treating patients as family, and the tremendous concern with the impact of this diagnosis cancer, not only on the patient, but on their family and loved ones. Finally, I would say Dana-Farber has always been very lucky. And what I mean by that is we've been the beneficiaries of incredible benevolence and philanthropy from our donors, not only locally, but nationally and now internationally. I actually met Jimmy of the Jimmy Fund. I have a picture of me with Jimmy and with Ted Williams when we went to the 1999 All-Star Game in Fenway Park. But from that small beginning with Jimmy has grown a tremendous, tremendous effort and outpouring of love, literally, from New England, but internationally. And I think that is unique. We are so privileged. We have the sports teams. We have friends and families of patients. It's extraordinary in my view. And I think what ends up happening is people want to give back for the care they have received here at Dana-Farber. And some people give back by doing walks and runs and bike rides, etc. But then there are those who have the means to actually give back financially. And they do so that they pay it forward so that people can actually benefit in future generations. So to me, it's really been a wonderful evolution in science, in clinical care, and the community, not only of researchers and caregivers, has markedly expanded because it includes patients and their families and all of these donors. I often talk about sports, and I often talk about curing cancer as a team sport. And I think the team is the researchers, the caregivers, everyone that works at Dana-Farber Cancer Institute, but it's a much bigger team. It's those who support our efforts, which is really an unbeatable team. Since coming here now over 40 years ago, I think the one achievement that I would take as the most important to me is having made a difference in the prognosis and outcome for patients who get myeloma. Myeloma diagnosis when I came was basically a death sentence. It was months or years, and it was often a lot of suffering and pain. Nowadays, it's not that way. We have so many new treatment options that have emanated from our work, both in the laboratory and in the clinic, an expanding myeloma team, that now offer patients, honestly, the gift of hope and the gift of life. And as I like to say, there's no greater gift than this. So I think that would be my major accomplishment. I think there's another I'll mention very quickly to you. I had the privilege to do the blood component laboratory at Dana-Farber Cancer Institute for many years, and I'm still associated with it. It is a wonderful place because people come week after week, year after year, for decades, and they don't donate money like we get with our Jimmy Fund and our benevolent donors. They donate the lifeblood, platelets or red blood cells that our patients need in order to be treated and honestly to have a favorable outcome in their cancer. The one joy there is that you can see literally the excitement when patients realize that others are donating blood products to help them, and conversely, that the donors are so motivated because they can help the patients. One finding that grew out of this that I'll just share, which is the following. It turns out many of our patients are susceptible to a complication called graft versus host disease. In plain English, that means when they get a transfusion of somebody else's blood, if they're immunocompromised, they can actually get sick and even die from the transfused blood product. And honestly, on my watch, we realized this issue. We participated with individuals all around the world, in particular in Japan. And since around the year 2000, all blood that goes to patients with cancer at our institute, the entire country of Japan, etc., is irradiated. And irradiation prevents that fatal complication of transfusion. So in addition to my contributions in myeloma, I really think that irradiation of blood is a marked life-saving strategy. My most cherished memories of at Dana-Farber Cancer Institute are with my patients. And I will mention a couple of quick examples, although every patient, each and every patient is very special. Many years ago, I had a school teacher from Martha's Vineyard as my patient. She was wonderful, 50 years old, and had myeloma that ultimately became untreatable. And at that time, we had a new medicine, a proteasome inhibitor, which had emanated from our laboratory. And I remember in the Dana building on a Sunday morning, gathered around this patient with her family, and actually quite sad, but with the opportunity to give her this new medicine. And a remarkable response occurred. She went into a complete remission, which means the myeloma was eradicated. And I cannot describe the feeling for you because, you know, there is nothing better than that. If you can have something that's going to change the world for patients, not only there, but in the future, it's just the best. I'll also share another anecdote here. I was privileged to take care of Geraldine Ferraro years ago, who had myeloma and lived 13 years, even when we really had hardly many new medicines at all. But I tell you this because at the time, she was the only woman who had run for vice president, and we became fast friends. So that meant going to many, many different venues to increase awareness of cancer, myeloma in particular, because Geraldine wanted to share with others and make a positive, hopeful outcome of her own illness. And so we testified in front of Congress, and there was a bill for research in blood cancers and education that was a result of that. We went to Red Sox games together, even though she was an ardent New York fan. And as she was wont to say, she would say, when it comes to cancer, the Red Sox and Yankees are on the same team. And we had just such a fast relationship and a wonderful relationship. And it just reminded me that even all of us, at the end of the day, when we get cancer, we're all the same. We need to really work together and help each other. And I was so in awe of her willingness and heartfelt commitment, even though she was very sick, to help others. And the final example I'll give you is someone that whose name you'll remember is Tom Brokaw. But one day I was sitting in my office at Dana-Farber and I answered the phone, and this at the other end said, "This is Tom Brokaw." And I said, it sounded like Tom Brokaw. So it ended up that he had a multiple myeloma. And in fact, as I got to know him more and helped in his treatment, it has been and remains an amazing privilege to get to know someone who has such a wonderful reputation for all that he's done, but is so down to earth and again caring about others. some people don't remember, but for many years, many decades, he told us about wars, he told us about rockets going up, desegregation, women's rights. And this was at a time when you could watch the news and actually believe what you were watching. And he told it from a Midwest, straight, honest, from the heart manner. And he's the same way. And as a consequence, he's written a book called A Lucky Life Interrupted, which is about his journey with myeloma, but which is now used as a playbook for families and patients with myeloma and other cancers worldwide. And he's been such a joy because he's selfless in terms of talking to patients, referring patients here. I can tell patients to call him. He just shares his experience and really has been a wonderful and a hero for me and an inspiration. I think in the future, Dana-Farber will remain a world leader in bench-to-bedside cancer research. I think the kinds of research that will be done here will be what we would all think of Star Wars research today. But I think the ability to use genomics and epigenomics at a single cell level is extraordinary. I think the ability to identify early those individuals who are predisposed to get cancer or other illnesses will be further characterized here, and it will allow early intervention. Patients will be identified, or even family members identified, that are at risk for cancer, and there'll be interventions before cancer develops, or certainly before treatment and complications of cancer develop. So that's number one. I think the other thing, and I really hope this is true at Dana-Farber, I hope we can go a long way to making sure that all patients, regardless of minority group or country in this world, can appreciate the advances of the science that comes from our efforts. I've been involved in, with our Food and Drug Administration in trying to lead efforts so that patients with multiple myeloma can have access to clinical trials and novel drugs. It turns out multiple myeloma is much more common in African Americans, and they're woefully underrepresented in clinical trials. And so we've made some considerable headway. The point, though, is that Dana-Farber needs to be a leader in the future, not only in making the cutting-edge science count for patients, treatment of patients, but prevention of cancer. That's goal number one. But I think the future goal of this institution needs to be a world leader in making sure that we take care of each other internationally, and that all of these scientific advances are actually available to patients all around the world.